So welcome everyone, and thank you for joining us for today's webinar, Smart Documentation for Care Providers, with presenter Jessica Stewart of Cloud9 Consultant. You all should have received a handout with this morning's reminder email that Jessica will be referencing throughout the session. I believe that was just sent a few minutes ago. If for some reason you didn't get that email or that handout, please email Kelly Owens. She can put her email in the chat and we'll be sure to get that sent out to you. And then this is the second of a three-part webinar series offered by the North Country Care Coordination Workforce Collaborative, or the NCWC, and is geared towards care case managers and or care coordinators. My name is Victoria Knierim, and I'm the Director of the Health Resources and Services Administration Rural Public Health Workforce Training Grant out of the Adirondack Health Institute, through which the NCWC was established. And then for those of you who aren't as familiar with the NCWC, it is a regional consortium of employers, providers, education institutions, and other workforce stakeholders established to create and provide care coordination training programs focused on rural healthcare workforce needs within 8 counties in northeastern New York, and to foster sustainable and inclusive career pathway for new and existing case or care managers. And today, I'm also joined by Kelly Owens, Executive Director of the Hudson Mohawk Area Health Education Center. Kelly and HMAHEC assist with North Country Workforce Collaborative Program Planning, Development, and Technical Support. So we're here today to help ensure the webinar runs smoothly. And a few housekeeping items. This webinar is being recorded and will be posted on the Health Workforce Collaborative website under the Care Coordination section, and we will put the URL in the chat. And then we ask that you remain on mute throughout the duration of the training. Cameras are optional. There will be time for Q&A at the end of the presentation portion. So we encourage you to enter any questions you may have into the chat box so we can review them during Q&A. And then lastly, we do have a brief program evaluation that we will email to all participants, and we'll put a link in the chat at the end of the program. Please take a couple minutes to complete the evaluation. Your input and feedback really does matter. It helps us to determine what to offer next. And then this webinar has been approved for 1 continuing education credit hour for social work, licensed mental health counselors, physical therapy, occupational therapy, and speech language pathology. Certificates of completion are also available. So if you would like CECs or a certificate of completion, please make sure you stay on for the remaining hour, and we will be taking attendance as the regulatory bodies that provide the CE credit require your full attendance. And then participants will receive certificates by email after the evaluations have been submitted and reviewed. Okay, so with that, now I'd like to turn it over to Jessica, and we hope you enjoy today's program.
Thank you, Victoria. All right, so we will dive right in. Today, we are talking about smart documentation for care providers. So about today's training, so SMART goals are important to both do with your clients as well as document. So, you know, you'll hear me say this probably more than once. If it's not documented, it didn't happen. What we want to do is we want to use SMART goals to inspire and motivate our clients to pursue change. So for care providers, when we create and support and use these SMART goals, it's a vital motivating aspect of our client's care journey. So during today's session, we do have an hour, so we will move through things quickly. However, there will be time for questions at the end. We're going to talk about what are SMART goals, why they matter. We'll discuss specific examples of SMART goals, how we can create our own SMART goals, and how we use SMART goals in treatment planning. You also have the clinical documentation resource that was sent to you. We'll go over some of the helpful tips on the last page of that document just to review at the end. So moving right along, what are SMART goals? SMART stands for specific, measurable, achievable, relevant, and time-bound. These are objectives that are designed to provide clear direction and empower change. SMART goals can be used in a variety of settings. I've worked in inpatient, outpatient, government, military, private practice, all different kinds of settings. You're able to use SMART goals. So it is something that can be really awesome to apply no matter what setting you're in. And it really does help our clients, which we will talk about specifically how. So breaking down SMART. S stands for specific, but this means that our goals should be clear and well-defined to provide focus. I just want to note that we will be using, you'll hear the term therapist or client throughout the time together. This can be, sometimes when we're documenting, we may say this writer, we may say case manager, residence counselor, whatever our setting is, that may change a little bit. However, for the purpose of this, we will be using the term client mostly, as well as therapist. However, again, apply this to your work and what makes sense there. But we do want to be specific and we want to be well-defined so that we do have focus. Also, measurable means that these goals need to have some kind of criteria so that we can track it, so that we have a definition of what does success mean. My favorite is A, because attainable means that we need to have realistic goals and they need to be attainable within our available resources. Sometimes individuals have these awesome goals. We're like, okay, let's get this moving. However, it's not realistic for the individual, or they don't have the resources right now. So we're setting goals that can't realistically be applied. So that A is super, super important. And you'll hear me say that probably more than once, but we want to keep this realistic and attainable. R is for relevant. So the goals need to align with the broader objective and values of the individual. If we're trying to set a SMART goal for someone, usually, we should be setting the SMART goal with the individual. But if we're setting a SMART goal for someone and they're not really on board with it, sometimes there can be a lot of friction. It's not really motivating the person. So what we want to do is we do want to align the goals with the individual's objectives, with the larger objectives that maybe they came to us with, as well as their personal values. And then T is time bound. So goals do require some kind of deadline. We want to ensure that we're being realistic with the time as well. We don't want to set a goal that cannot be achieved, or it's unclear when the individual is able to attain the goal. So we'll talk about that a little bit more as well. But SMART stands for specific, measurable, attainable, relevant, and time-bound. Sometimes you'll hear individuals refer to SMART goals as objectives, SMART objectives. Really, objectives is kind of a better fit in the way that it's a more specific. But for this purpose, we're going to talk about SMART goals, and we're really going to get into specific things that we can do to make sure that we're helping our clients move towards a change in a realistic, sustainable way. So this is step by step, but this is typically what happens. This is just very general about what happens when we meet a client, when a client is brought to us. There's some kind of assessment, whether that be a formal psychosocial assessment or just some kind of general assessment. And from there, we may identify some problems. Usually we see opportunity for improvement in various areas of life. It's not just necessarily one issue. But from there, what we want to do is we want to try to make this assessment of where are they at in their willingness to make change. Are they really willing to engage in treatment right now or care? Are we seeing, them being pressured into it? Maybe they're mandated to care by court or legal entities. So we want to kind of assess that, keep that in mind. And then what we can start to do is identify the problems that they can work on with us. So during our time together, we don't generally want to address every single goal because it can be overwhelming. It's not very smart of us. If we say, hey, I'm gonna change every single thing in your life so it's better, that sounds great, but it's not very realistic. So when we meet the person, we can see, okay, they got some different areas of opportunity that we can improve on together. We can assess, okay, what are they willing to do? How motivated are they? Then we can start to say, okay, well, these kind of things seem realistic that we can work on during this time together. And then we can say, okay, these are the overall goals. So we identify these are the problems, here's some overall goals, and then we can get into our SMART goals or our objectives. So really it's kind of like a filter process. You take in, the individual, you really want to learn more, a holistic approach, and then we want to narrow it down. So what we can do is we can work together and we can help that person make lasting changes in their lives. So, friendly reminder, the stages of change are pre-contemplation, contemplation, preparation, action, and maintenance. These are great when we are assessing where the individual is at, how motivated they are to engage in treatment. So pre-contemplation, you're not really thinking about the change. Maybe you're mandated or you're pressured into care. Maybe, it's not really, you may say, I don't really have a problem with this, but other people are telling me that I do. Or, someone else is telling me that I should change this. I'm not really buying it, or I'm not really sold on it yet. Contemplation is you're thinking about it. So maybe you're weighing the pros and cons of making a change. Preparation, you're actually preparing for it. Action is you are doing it. You are actively taking steps towards that change. Something to mention in this is that sometimes individuals may assume I'm in treatment, so I'm already in the action stage. But I would encourage you to use your judgment. That's not always the case, and typically is not. And then maintenance is something where we have a lot of awareness that, okay, this is an issue. We don't need to spend that much effort into maintaining at times, generally speaking, because we've gone through the thoughts of change, the actions towards change. So we're just kind of maintaining. So stages of change, this can be a wonderful thing that we can use in our clinical documentation. You'll see that in the handout, just a list of the stages of change, because we can use these stages to support our documentation. Pro tip, let's work with the stage of change instead of against it. So maybe the individual says, hey, I'm in action stage of change. And we say, oh, to me, that seems like they're still kind of contemplating whether they really want this or not. Let's just go with where we assess the individual is at, and let's try to work with that instead of trying to fight against it. Let's work with where the person's at and help them grow. So why are SMART goals important? SMART goals are important because they help the individual make realistic, manageable changes that will last. So we're helping them feel achieved. Individuals have enhanced motivation when goals are SMART. So clients can feel the progress. They start to build momentum. They can push through times that maybe are challenging because they feel a sense of purpose. They feel a sense of direction. Also, it helps people feel confident in their ability to actually make the changes. So we start to see better adherence to treatment plans and improved outcomes when we use SMART goals, because again, the person is building momentum. Also, one of the huge benefits of SMART goals is that it's clear. So patients or clients can see what they can expect when they can see, okay, we have these goals. By the end of these sessions, or by the end of going through this, there's kind of some light on the end of the tunnel. Wow, maybe I have to put in some hard work during these sessions, but like after that, I can see how it's contributing to the overall goal. I see how these small steps I take now can add to this big goal that I've really wanted and help me make that change. And also, SMART goals are awesome because what they do is they help people own the outcomes. So because you're specific, because you're clear on the goals, it allows individuals to take responsibility for the results. Hey, you remember when, we tried to address this? Remember this homework and you didn't really want to do this, or, it took a little bit. okay, that's okay, but this is why maybe this is taking longer. We can see where things could be improved. We can see where things were accomplished, and it helps people own and feel good about what they're moving towards. So SMART goals are key to an empowered client, but spoiler alert, it's awesome because they help you feel good. That's right. I've worked inpatient, and I can't tell you how many times I've had interns or colleagues say to me, Jessica, I just feel like it's kind of a bummer. I'm not seeing the individual make progress, day after day, I don't see progress. People come in and out, and that's certainly common. I've worked emergency room settings as well, where we maybe don't see all this amazing progress that we might see in outpatient or private practice settings, or just community settings. We may see progress with individuals. However, sometimes in more acute brief settings, we may not see that progress. SMART goals allow you to see progress even in shorter or briefer instances where we're interacting with someone. Because again, it allows the individual to feel motivated, but also it allows you to feel motivated. So you can go to work saying, okay, you know what, maybe this person didn't totally change this, but I was with them and they took steps towards it. And it helps you feel good. So it helps you wake up sometimes and, maybe the majority of your client load or caseload isn't doing too well. Or, maybe you've had someone that, was kind of like, oh, this person was doing really well and now they're not doing so well. Maybe they're struggling. The SMART goals also help you remember that you are making an impact. You are helping individuals. Your job is important. And, I can wake up, hold my head up high and say, despite maybe some challenges or some things that went on that weren't so well with some of my clients, I can also feel a sense of progress. I can feel a sense that, I'm making a difference, because of course you are in this field. So pro tip is, in clinical documentation, what we want to do is we want to use our client's name. So generally speaking, insurance companies do love when you use the individual's name. So speaking even from inpatient standpoint, sometimes, they would say, hey, I like that you write the person's name. So write the person's name. It helps give a more personal approach. If they say, if your place of employment says don't use the client's name, then don't, of course, but using your client's name can give it a personal touch, and it can also remind you and help you connect the goals to the individual. So I love the movie Shrek, but a really great way to think about it is, if you created this goal for a client and you're like, I wonder if it's a SMART goal or not, just see if you can break it down. See if you can peel it down. Break it down into even smaller steps. So you've heard, if you've seen the movie Shrek, onions have layers, ogres have layers. Well, guess what? Your client goals have layers too. And a lot of times it can be kind of fun. I love this stuff. I love clinical documentation and talking about it. But one of the things that can be really exciting and fun is when you try to peel things down, because then you see more opportunity. You see more opportunity to gain momentum. You see more opportunity to support your client and help them apply things in realistic settings, so those changes last, so they feel good. So really, if you can try to peel down a goal, if you have a goal and you're like, is this a SMART goal? Try to see if you can peel it down, because a lot of times you can, and it can only help the client. So one of the things that is a little debatable in SMART goals has been, should I be in the SMART goal? So, I'm here, I'm working with the client. Should I be about it? There's two kind of ways, and yes, spoiler alert, either way works. Some people take the position of, it's not about me, let's totally focus on the client, leave me out of it. So in that kind of thinking, we will use terms more like client will. So like, client will explore how current living situation impacts sobriety. Okay. If we go about like, hey, teamwork makes the dream work, I don't mind being in the goal, and it's actually showing that I'm supporting this client through that, that's wonderful as well. So therapists will explore with client how current living situation impacts sobriety. Client even will explore therapist how living situation impacts sobriety. So you can see that we're working on the same thing. We're working on the same goal. It's something that can be accomplished in a sitting together. However, what it does is it includes a therapist. It doesn't, you can determine what you're comfortable with and what works for you. And your treatment plans don't need to be one way or the other. It can be a mix. So maybe all of your goals have client will, and then you have one where it says therapist will educate the client on the impact of alcohol use on, whatever. So you can decide whether you want to be in the SMART goals or not. Whether you're in them or not doesn't make it a SMART goal. So pop quiz time. I know we're moving quickly, but we have a lot to cover, and I definitely want to make sure that we're able to get into any questions as well. But pop quiz. So we have these, and feel free to utilize the chat. So we have these goals. I'll read through them, and then feel free to utilize the chat or just think in your head what are SMART goals. So Jane will reduce her anger. Jane will develop positive coping skills for anger. Jane will practice deep breathing when angry. Jane will identify 2 situations in which she recently felt angry and discuss the triggers associated with each situation. Jane will utilize one grounding technique to
How you doing?
Therapist will educate Jane on 2 mindfulness techniques that she can utilize when feeling angry. Jane will explore with therapists how primary caregivers manage anger and discuss impact on self. And Jane will not get angry this week. So looking at all of these, there's some goals that are more SMART than others. And I will say, standing out, Jane will reduce her anger, pretty vague, as well as she won't get angry this week. It sounds nice, but how is that even accomplished? Jane will identify 2 situations. So number 4, that's something that you can sit with the client and you can work with Jane on. And that's a SMART goal. Another SMART goal is 6. So it's something that you can do you can educate, and this is with the therapist involved, the terminology, but the therapist will educate Jane on 2 mindfulness techniques. So that's something that can be accomplished. You can sit down with the individual, you can sit down with Jane, and you can talk about 2 mindfulness techniques, and then you can check that off and say, hey, good job. And then you can refer to it back, maybe you're doing a treatment plan review, you're looking over your progress, and you say, hey, remember when we went over these 2 things? Also in sessions, maybe you start to see Jane get angry, and you say, hey, remember we practiced these 2 a couple of sessions ago? Why don't we try one? So it's something that can be applicable, and it's specific, and you can sit down and you can get it accomplished together. Another thing is it doesn't maybe at first appear super specific is 7, but Jane will explore with therapists how primary caregivers manage anger and discuss impact on self. So that can be something that's SMART. You can take it even a step further, and you can say how a specific primary caregiver managed anger and discuss impact on self. You can, break it down even further and say discuss one impact, at least one consequence of viewing the specific primary caregiver's style of managing anger. So you can break that down and work with that. But generally speaking, 7 is something that you can sit down and you can accomplish with the individual and keep it moving. So 7 is SMART. It can be peeled down a little bit more to make it even better, but it is something that can be considered a SMART goal. So we have 4, we have 6, we have 7. One of the biggest things that I see working with individuals is 5. So Jane will utilize one grounding technique 2 times a day for 1 week. That's overwhelming. So at first, a lot of people say, well, it's specific, it's measurable, but how realistic is it that you're going to continue to monitor that? So let's just like thinking about that, we'll move right into some of the learnings from the pop quiz, is that when we ask these kind of questions, some of them that we just reviewed, what we're doing is we're making sure that our treatment plan counts. And the cool thing is that, maybe right now you're like, this seems like a lot of information. It becomes a habit. So it becomes natural. It's easy to write a treatment plan with SMART goals once you get the ball rolling, once you get into a little practice. So these are some of the questions that we can consider. Can I tell when the goal is complete? If they're not going to get angry, or they're going to reduce their anger, how am I going to know when the individual completes that goal? And we just want to make sure that in our treatment plan that we have something that kind of supports that. So, can I tell when the goal is complete? How much of a burden is it for me to monitor that goal? So like we just talked about on the previous slide, are we realistically going to monitor that person 2 times a day for a week? Are we going to remember in our next session to check in with them? Are we going to ask them specifically what days? Are we going to ask them to document? Again, all these things can be a little overwhelming. So there's ways that we can break it down, make it more manageable, and then we can check in with the client to see. We can talk about realistic situations that they can apply whatever coping skills. So how much of a burden is it for me to monitor the goal? Also, can we break this task down even smaller steps? Remember peeling it back? How uncomfortable is this task for the client? So a common misconception is that, we don't want to make our clients uncomfortable, but really what we want to do is we want to gently support them as they feel uncomfortable, as they experience some discomfort. What happens is individuals can experience, discomfort, but we're supporting them. We're helping them feel resilient and build those distress tolerance skills. So we don't want to create a goal that's super uncomfortable, that's not likely that they're going to apply in their real life. But we also maybe want to ensure that some of our goals do pull the individual out of their comfort zone a little bit. And for some of those more uncomfortable goals, we may want to build up to that, again, because the person has motivation. Something we want to ask ourselves as well is the goal too general? And does the client agree with it? So we have this overall goal of maybe reducing anger. Does this support it? So maybe the client agrees with addressing anger, but doesn't see how talking about family history would matter. So maybe what you want to do is you want to help them understand that. And you want to make sure that that aligns with the overall objective. A very, very, very important thing, again, is how would you know the goal is accomplished? How can you tell the goal is complete? And then when can you check off this goal is accomplished? So if you are constantly going over the same goal, like for example, Jane will reduce her anger, when are you going to be able to check that off? How do I know that's even accomplished? So thinking of when can I check off this goal? Ideally, you meet with someone, you process something, you discuss something, you explore something, you educate, you encourage, you assist them with processing, you role play, and then you can kind of check it off and take the next step. And that's what we want to do when we're thinking about SMART goals, is we're taking steps towards that big change. We're not taking a giant leap that is really throwing the individual out of their comfort zone. Maybe they don't feel so motivated. Maybe they already feel pressured, or they're not really in this, fully buying the change. So what we want to do is we want to introduce them to the change in ways that's realistic and that really helps them feel motivated. And again, one of the biggest things too is, are the goals realistic for the time we have together? So maybe you have all these goals. I've seen individuals write incredible treatment plans, and I'm like, is that person going to be with you for 6 months? Because if you're writing that for 30 days, it doesn't seem very realistic. So even with the best intentions, sometimes we say, yeah, this is great. I want to work on this and this. If you see the client once a week, you may not be able to accomplish all of those goals. So keeping in mind too, how long is this person's time with me, as well as, maybe I don't know specifically, but like, let's maybe keep it a little conservative, and then we can build on it. So we want to set an almost offensively low bar and be prepared to celebrate overachievement. So I can't tell you how many times with individuals that I've been, maybe I have a client and we're setting a goal and they say, I could do that. It's kind of like, hey, I'll go to the gym 5 days a week. It's not very sustainable. Maybe the person does, and that's awesome for them. However, a lot of times it's not sustainable if we just jump in. So what we want to do is we want to set a really low bar. So for example, maybe the individual says, okay, I'm going to go to the gym 5 times this week. This is just a random example. Okay, that's great. How about you go to the gym once? No, like I can go at least 5 times a week. I'll plan it out my calendar. It's going to be great. Why don't we do 1? If you do more, then that's great. And we'll talk about it next session. Well, I'll do at least 5. That's awesome. Your goal is 1, and we'll talk about it after, but like, you're doing great. I totally think that you could do 5 if you wanted to, but also, you know, things might come up. So let's set a goal for 1, and then we'll assess where you're at next week. So we can do things like that with our clients. Sometimes we just need to phrase it in a way that's very supportive and acknowledge, hey, I totally believe you can do this. I know that you can overachieve, or I know that you can do that. You're capable of that. That's great. But we're going to set this as our goal and allow that overachievement to occur. So SMART goals are made, they're not born. These are some quick tips. Is that when we practice and engage in active listening, what happens is we discover the problem areas that we can address. So maybe the individual comes in with a substance use issue, and you know, that's all on paper what's going on. But what we hear in the back of our head is, whoa, this person has said they lost both of their parents. And this is something that's really been triggering to them. This is something they've mentioned a few times. If we're actively listening, we can pick up on that, and we can ensure that we incorporate that into their treatment plan and create some SMART goals that can help support any kind of changes or processing that needs to happen. We want to be, for tip 2, we want to be both realistic and empathetic. So we want to work with any kind of limitations, like we mentioned, length of treatment. We want to be empathetic to the needs, but sometimes we also have to be realistic, and we have to help the individual scale back some of the expectations. If the individual has expectations that are not realistic, oftentimes, you know, we want to address that right away, because we want to help the person make the adjustment so that they do feel accomplished. We also want to get buy-in from our client. If we're able to, the client support network. So if you know, if you're working with a case manager, a doctor, a family member, anyone that's supportive of the individual and going to help any kind of the holistic treatment plan team or treatment team, you know, try to get buy-in from them too, if you're able to. You know, maybe you schedule a family session later on, or maybe you include that in a SMART goal to have a discussion with the doctor about medication or something. Get buy-in from your client, but also utilize that support network to help move towards the SMART treatment planning and make those changes. Also, tip 4, we don't want to shy away from challenge, discomfort, silence. Silence is a big one that a lot of people are uncomfortable with, but these things can be especially meaningful during treatment and care. So we do want to allow time. I know I'm talking quick today, but I will say one of the most powerful tools that I have found in therapy sessions has been silence, because what it can do is it can allow the person to process. It can allow the person time to think, and maybe even communicate a more meaningful response. So we don't want to shy away from that. Maybe a client is slightly uncomfortable. They say, well, you know, I don't know if I'm going to be ready to call my brother during our treatment time, but I'm open to it a little bit. So maybe we put that in as a SMART goal for a later time. And as the person builds momentum, we recognize, hey, this person, you know, I think it would be beneficial if they reach out to this individual, then we can do that. So don't shy away from challenge, discomfort, and silence, especially if you can see the bigger picture that it might really assist the client later on. It might not be a goal that you address right when you meet, but it could be something later, a SMART goal that could really make a meaningful impact that the person didn't really have confidence that they could even do. Tip number 5, break it down, break it down. Peel away those SMART goals and see what you can do, because again, those smaller steps can help build momentum. Some helpful terms that we can use when we are using SMART goals: explore, identify, educate, discuss, role play, demonstrate, practice, and verbalize. These are all really great terms that we can use, and they help us maintain a little bit of objectiveness. So it helps things sound professional. We'll get into the helpful tips, terms, and phrases from our clinical documentation resource in a little bit. But these terms are very, very helpful when we are to have in our back pocket when we are using SMART documentation, when we are creating SMART goals, because these give us options on kind of how we can support the client during their time with us. Pro tip: speak your client's language. Oftentimes we see clinical terms being used and there's just miscommunications. Also, people don't ask when they don't understand a concept or a term sometimes. They may say, oh, yeah, okay, what is that? So sometimes with the best intention, we may throw out clinical or medical terminology and the individual can feel frustrated. So, you know, you don't need to talk to someone in a way that's belittling or anything like that, but sometimes, you know, asking the person if they understand the term, or just using common terms to communicate something that you're working on. What it can do is it can make the person feel respected. It can make the person feel that they can talk to you about things more and that you're not, you know, over them, or that you're not like confusing them in any way, that you're aligned in the direction of your character and your work together. Another pro tip, back-to-back pro tips, is limit your use of the word coping skills. I can say that a lot of times therapists cringe when I work with them, when I'm doing consultations, and they say, well, you know, coping skills, coping skills, coping skills. And I'm like, oh, if I hear that term one more time. So there's definitely an appropriate use of the term coping skills. However, we just kind of use it over and over and over and over again. So sometimes what happens is the term coping skills pulls us away from SMART goals. So we're not using SMART goals anymore because we're saying coping skills. So tell me, what coping skills? What do you have in mind? You're the professional, right? I've heard, maybe I've been in rehab for, this is my 3rd time in rehab, and everyone keeps telling me, utilize my coping skills, utilize my coping skills. What does that mean? Rather than, oh, you know what, there's grounding skills, there's deep breathing skills. What are you specifically going after with the client? What can you as a professional bring to them as coping skills? So there's an appropriate time and place to use coping skills. We just don't want to continue to use it over and over again, as well as considering our last tip is that sometimes people don't necessarily even know what that means. Like, what does that even mean? I've heard it say over and over and over and over again, but like, let's break it down. So coping skills, unfortunately, is a term that's used over and over and over again. And sometimes it's just like, you just black out, you hear it so much. You're just like, you know, over and over again. I would say in, you know, kind of the tech world, it's kind of AI now. AI. Okay, what is an AI right now? So coping skills, we want to be sure that we're using it appropriately. And we will discuss a specific instance where we do break that down as well. So this is an example of a client, some treatment plans, or a client comes in with some issues. So the client comes in, let's say they state to you, hey, I'm having panic attacks at work. So let's just break this down to 2 goals. We have 2 main goals, let's say. We'll go to the right first. So let's say we want to say, okay, let's reduce the frequency of those panic attacks. So an example of a SMART goal would be, we're identifying 3 symptoms of anxiety and explore ways to reduce the intensity of symptoms. Okay, so we're thinking about things that cause the anxiety and how to reduce the intensity. So we're not even specifically going into specific panic attacks per se, we're going into symptoms of anxiety. And I do see that the T and the P are need to be switched, but moving to the next SMART goal with the overall goal of reducing the frequency of panic attacks, we see client will discuss the most recent panic attack and identify one way to de-escalate self in a similar situation. So what we can see here is that we're getting specific. So that client can sit down with you and they can discuss their most recent panic attack and identify one way that they could de-escalate themselves in a situation that could occur in a similar state. So these are 2 things that we can sit down with the client, we can check off the list that we did this together, and we can also remind them of in future sessions and say, hey, remember when we were talking about your anxiety and different ways to kind of calm it down? You know, what can we apply right now? Because I see that you're getting a little anxious. Let's pause here and let's use something that we talked about in a previous session. And then what we're doing is we're helping them realistically apply it. Another goal that can come off of a client coming, an overall goal that says, I'm having panic attacks at work, we could say, okay, well, utilize the CS, those coping skills to reduce anxiety. Again, coping skills, not specific enough. So sometimes people unfortunately put this as a goal. The client will utilize coping skills to reduce anxiety. Super vague, not specific, not super helpful. Like, great, yeah, if I could do this, you know, I obviously wouldn't have maybe a severe panic attacks or wouldn't be having panic attacks. This goal is great, but it's super general, and that's why it can be kind of an overall goal. It's not a SMART goal. A SMART goal with this, let's take out those coping skills and let's talk specifically. So client will practice one grounding technique that can be used to reduce anxiety. Awesome. I'm going to pick a color in the room and I'm going to point out all the things in that, and that's my grounding technique. And I'll talk to the client about that. We'll practice it, check off the list. Awesome. I can refer to it in another time where maybe I see that the individual's getting anxious. I can ask them if they applied it, this past week. Another SMART goal that can come out of this, the therapist will educate client on deep breathing techniques that can be utilized during feelings of panic. So now we're using the therapist will, and it's very appropriate. We're going to educate the client on deep breathing techniques. So maybe I pick out 2 or 3. We talk about it during session, we practice it, and we talk about, maybe even some specific instances where it's helpful. So what we did was we just have 4 SMART goals right now that can help build that momentum. So I hope that when you look at this, you do start to feel a sense of, okay, I can check this off with the client and we can move forward. And the cool thing is that they're all realistic things that I can take and, help the person remember them in times where maybe I start to see they get a little anxious. I could check in. Oh, you said that you had a panic attack at work. I'm so sorry to hear that. Last week we talked about grounding technique. Were you able to utilize that, or did you think of it prior to, the panic attack when you started to feel anxious? So now it's cool because what you're doing is you're building momentum, you're supporting the individual, you're empowering them to utilize what you're doing together. All right, so one of the bigger questions too that I get is, before that, let's get into the treatment plan is meant to be a living document. So there are certain entities that will require 30 days. You're doing treatment plan reviews. However, remember, we can add, we can defer, we can close goals at any time. What we want to do is we want to, we don't want to create an overwhelming amount of goals. We want to create realistic, attainable goals, and we can always add to it. We can always defer. If we have 50 goals all at once, SMART goals, even if they're SMART goals, it can be overwhelming. So what we want to do is we want to, start with maybe some of the important ones, start some of the ones that can help build momentum, and then realize we can change things, we can adjust if needed. Question, within 30 days, do you ever change your mind or focus? Yeah, of course. So we want to maintain balance between keeping on track, because if you don't keep on track, if you just keep changing every time, you're not going to see any progress. And now you're going to be frustrated, your client's going to be frustrated, probably whoever's reviewing your documentation is going to be frustrated. So, we want to balance keeping on track, but we also want to know that we can make any edits or changes as we move through treatment if it's needed. So one of the big things I get asked about is dual diagnosis and co-occurring conditions. So, that's great. We talked about a lot of SMART goals, but there's a lot of complexity to this. So sometimes individuals with co-occurring disorders and dual diagnosis, there's specific challenges that can arise to this. So there's a list here on the right-hand side that need to be considered when we are making treatment plans for individuals with co-occurring conditions. So sometimes there's some complex symptom interactions going on, and we want to be aware of that. We may take a little bit longer with our assessing the situation and what goals we have, the willingness when we are working with this population, because there's a little bit of added complexity to it. We also may want to consider medication management. There's comorbid conditions, what is going on here? Does medication management need to be a part of this? Does that make sense? Treatment adherence, stigma and discrimination. We definitely want to make sure that we don't have any kind of language that indicates any kind of bias or anything like that in our SMART goals, which we will talk about in helpful tips. We will probably want to address relapse risk if that's not in there. Integrated core coordination too. I didn't mean to skip over 5, but integrated core coordination, we may really need to or want to include. If there's multiple conditions going on, I've worked in various settings, like I said, and for example, as part of a substance abuse clinic, and I was a licensed mental health counselor. However, I was working very closely with, I can remember one individual, I worked very closely with the mental health counselor, and we got a lot done because it really felt integrated. And the client approached us as like, hey, these two therapists are my team, and we made goals that complemented each other. We may also, if we go to 7, we may want to address any kind of limited access to specialized services, as well as any kind of social and environmental factors that can impact treatment or care. Motivational challenges, of course, as well as any kind of dual focus requirements. Sometimes there are requirements that come, if you are, for example, if the primary diagnosis is something that is substance use related, there may be specific requirements that you do have to address certain goals, or at least include that topic into your treatment plan. So this is just a very brief idea of what treatment plan, some considerations, but what we're going to go into next is what maybe some SMART goals can look like with the dual focus population. But for that, pro tip, manage expectations and keep focus. So we just talked about balancing focus. We want to be able to change and edit to support the individual's growth and change towards their larger goal. But especially with the dual focus and co-occurring condition population, it may be especially helpful to manage expectations and keep focus. So if we see like, oh, I'm changing this too frequently, we may not be really making that much progress, and we may be confusing our clients. So if we can keep focus, it can be especially important when working with individuals with dual diagnosis to keep some kind of focus, to really, take a step back and say, do I need to change this? And why am I changing this goal? Or why am I, saying that maybe we defer this? Really make sure that it's meaningful if you are making changes, because that focus can be really helpful for individuals that have a lot going on and complexity to their cases. So next is, this looks big, but we're going to go through this. And I know I'm being mindful of time, so we will move a little quickly. But let's say you have a client that's mandated to treatment by drug court because of a DUI. So again, we want to be mindful of the length of treatment. So we don't want to be overwhelming. We don't want to address every single problem. So if we see to the right there, financial problems, we say, okay, I'm not going to even address that because we don't have enough time together to do that. And that's not my specialty, right? So we're not going to do that. But maybe we say, okay, they have to address legal issues. And one of the things is they need to understand the seriousness of the DUI. They need to communicate that to court. So now we see 2 SMART goals. They'll identify 2 ways that his use has impacted his legal status. We'll talk about 2 possible consequences that can result from driving under the influence, so that can communicate to the court. This individual knows what's going on. They're not going to do this again. They understand the seriousness of drinking while intoxicated. Another thing we might want to address is family relationships. Maybe they had an argument with his dad prior to the DUI. So we talk about role-playing assertiveness techniques, and we talk about who can identify as a support system. Maybe the dad's not, but maybe we find out who is and why. Another thing is this individual may have major depression. They've been diagnosed with it. So we identify strategies to avoid isolation, as well as how the depressive symptoms impact substance use. And the same thing, we can address a substance use goal because they're saying, I have this depression and anxiety, and that's, what I do. It kind of led up to this frustration, the argument with dad, and this is how I got the DUI. So we can combine that substance use goal and major depression and have a goal as well as how the depressive symptoms impact substance use, also how the substance use impacts depressive symptoms. We can also identify 3 triggers for substance use, and then throw in something like, the client will submit to 1 random drug test. If you do 3 drug tests, if you say, 1 drug test every week, it can be hard to kind of manage and track. So what we want to do is we want to make sure it's reasonable, it's something that's attainable. And then again, we can build momentum. That doesn't mean they're only going to get 1 random drug test, but what we can do is we can check that off when the person accomplishes it. All right. So I know we talked through that one quick, but I do hope that you see how these goals are SMART. There's something that we can work through. There's something we can build on. And if you take a step back and look, if this person accomplishes all that, that's pretty awesome progress. If they spend 1, 2, 3, 4, 5, 6, 7, 8, 9 sessions with you, and they address each one of these SMART goals, they kind of did a lot of work. I mean, they did a lot of work. So it's awesome. And you can pat yourself on the back as well as your client. All right. So treatment plan examples, some problems and overall goals. The person says, I feel bad about myself. I can't really speak up when others hurt my feelings. So we want to improve that individual self-esteem. Again, overall goal, not a SMART goal. B, another person says, my family says I need to stop smoking pot. It's causing problems. And they're saying, I guess, so maybe they're not, fully there. Maybe it's like contemplation, and I'm anxious all the time. So we want to say, okay, during this treatment episode, they're going to refrain from using marijuana. Not forever, because ideally, but we don't know. So A would be, we have this improved self-esteem. Here's some SMART goals under it. We can educate them on passive aggressive and assertive communication styles. We can discuss the relationship with maybe the sister and how self-esteem has been impacted. We can identify a mantra that they can utilize when feeling negative, as well as role play assertiveness skills to utilize in situations where maybe he feels unheard. Another thing, if we have this overall goal, if the client refraining from using marijuana during treatment, we don't want them to use marijuana during this time, we can identify 2 ways that the marijuana use has impacted her life. We can role play 2 coping skills that she can utilize when feeling triggered to smoke, as well as educating the client on how the marijuana use can impact mental health symptoms, because again, they reported that feeling anxious. So you can see how those are a little more specific and SMART. So what we did talk about today, and I do want to leave a little extra time, is we talked about SMART goals, why they matter, some examples of SMART goals, how we can create SMART goals, and how we can utilize it in the treatment planning. We also talked about some pro tips, which I do want to just review very quickly on our helpful tips, terms, and phrases, is that what we want to do is we remember that we don't do things for our clients, we support them while they do things for themselves. So a perfect example in treatment planning is phone calls. We support the client as they contact their mom to invite their mother to family day, right? We're not calling for them. We're not doing it for them. This is a great way to write a SMART goal. We're supporting them as they do something. We want to replace any kind of but. We never want to see but in treatment planning ever. We never want to see that in our documentation. So when we're writing things out clinically, let's use however if we need to use that statement. Also, we want to make sure that we are writing in a way that we can explain it to insurers. We don't want to make things that are debatable. I had an instance where it was months and months later, an attorney came in and they called me into the room and they said, and I was in a hospital setting, and they said, okay, what happened during the session? I literally was able to pick up my note and read it and say, this is what happened. I did not remember the patient. It was inpatient setting, but it was very acute. I didn't remember, but I was able to recall, I was able to answer all questions because I documented correctly, and I was able to be confident in my response. We want to consider the individual's level of participation. If they required prompting or no prompting, that's something that's great to include in any kind of documentation. We never want to use the word said. Client denies. If the client said he didn't want to do something, client denies. Client states is professional. Client refuses to. If you do communicate that the client refused to do something, then you need to include how do you know that. So we don't want to make any kind of assumptions. We don't want the person to say, well, client refused to come to group. Well, why? Why did client refuse to attend group? Let's include that. Client refuses to attend group despite prompting. Client states, which we'll get into in just a moment, as evidenced by is a fantastic way to communicate what we're observing that might need some kind of justification. So we don't want to say, hey, the client looks tired. The client presented lethargic as evidenced by frequent yawning and rubbing of the eyes. We never want to use the term bad. We can use things like terms like at risk might be more appropriate. And then also we will talk about in part 3, the use of at this time. We want to use that appropriately because it allows for progress. It allows for change. So for example, we always want to use this with when we're doing an assessment on suicidal ideation or homicidal ideation. Client denies suicidal ideation at this time. Why? It makes sense. Let's say client denies it's me. 5 minutes later goes to the psychiatrist and says they're suicidal, says they're feeling suicidal. What happens is it can be like, well, that doesn't really make sense. However, if you say, hey, client denies suicidal ideation at this time, and then the doctor writes, hey, the client is reporting suicidal ideation at this time, I clearly see the client changed their mind or something happened, right? But if you just keep saying, you know, clients deny suicidal ideation, it can be a little bit more abstract, and it's not just straight to the point communicating what you may want to communicate. We also want to write out any numbers. If you have fantastic, not really, handwriting, such as myself, numbers can be a little debatable. You may not be able to tell. Even if you're typing numbers, it may not come out as clear. So just write things out, like write the number out. And then last but not least, client quotes are the gem. They're the best. So it shows specifically what happened. Each interaction that you have with a client, ideally, will have a client quote. So if you can write a client statement, write it. If a client is in their room, they don't want to participate, and they say, you know what, leave me alone. I don't want to, you know, I don't feel good today. Write that. You know, client refused to engage in session today. Client stated, leave me alone. I don't feel good today. Therapist will follow up with clients at a later time or whatever. So use those client quotes. Those are the gem. They're the best. They're the best reflection that we can communicate the client state, as well as letting insurance companies, billing entities know what's going on with the client. So that being said, there's a part 3 of the anxiety depression training series when September 12th. It's called Tactics for Meaningful Work with Challenging Populations, where we're specifically going to address suicidal clients in critical situation mitigation. And now I know we only have a minute or two, but please feel free to ask any questions at this time. Thank you.
You can either take yourself off mute or type a question in the chat and we can relay that to Jessica.
And if not, that is totally okay. You can, if you have any questions, you could write them down. We will be seeing you in September, hopefully. So feel free to join in September. And thank you very much, everyone, for your time.